Welcome to the Beauty Scientists with Dr. Kristy Hamilton and Dr. Roy Kim. Real beauty without the hype.
First off, one of the new topics that you and I know about is SkinVive, which is an HA filler made by Allergan that actually is injected mainly into the cheek, although outside of the US, it's actually injected all over the face and even the neck.
Yes. And have you tried it?
I have tried it once. It does work. It does not seem to be like as game changing as I thought. I think it's because it's only HA filler and it's not Botox or neurotoxin with HA filler.
So in my practice, I do a cocktail to micro-infuse the skin. I believe you do as well. And we incorporate neuromodulators like Botox or Dysport, injectable grade hyaluronic acid, and then we can customize it to the patient's skin. Growth factors, pigment correctors, vitamin C, anti-free radical agents, and antioxidants. And I find by infusing with the microchannels as opposed to needles, we go over the entire surface of the skin and we get it into the skin itself, as opposed to injecting with the needle on the grid pattern with SkinVive.
You know, I forgot to tell you, the needles that come with the packaging are okay, but they tend to get dull. There's a couple products from overseas. I have some needles from Korea. I should send you some. They are super sharp. So specifically, they're made to Japanese, Korean, German stainless steel standards. They stay sharp. So they're not as painful. And they're actually the correct depth. They come actually in different lengths, different depths to deliver it to the skin.
That I think makes a lot of sense. It's something when I was talking with the company, I mentioned maybe they need to consider how the product's being delivered just as much as the product itself.
Right. So the product, has to be fresh, of course, but the product has to be delivered to the proper depth, which I think sometimes is hard to do with regular needles and regular syringes. To be honest, I don't think it's the syringe. I think it's the needle and the consistent needle depth and how deep it is.
That makes sense. So for the viewers, what do you think? What are the benefits of SkinVive and products like it around the world?
Around the world, the big thing is what's happening in the US. It's the combination of neurotoxins and HA fillers, as well as the growth factors. In the US, it's very difficult to get 2 prescription medications into one actual pill. That's just what the FDA has deemed impossible for the most part. And so that's why it's been hard aesthetically. But I do think that we can do it, or we can certainly do it in the office, just like you're doing.
Yeah. So the off-label mixing,
Yeah.
I think I agree with you. I think it's a superior product. And one of the reasons that they rebranded or repackaged this product, which is hyaluronic acid, so it is like a filler, but they rebranded it as a skin booster because it's not for sculpting the face. It's not for changing the bone structure or folds or hollows. It's really for direct infusion into the skin, because we all know, you do beautiful filler work. I like to think I do too. So for our patients, fillers are a good thing, but there's a lot of patients that have had bad experiences with fillers, pillow face, etc. And so by repositioning it as a skin booster, it's an interesting way to reintroduce hyaluronic acid to patients.
Totally agree with you. And it's, multiple papers have shown like it increases your skin quality, the skin texture, makes your pores smaller. So that's what's cool about this combination treatment. And I'm glad that you're doing it, although it sounds like you're doing what I'm doing. We're like combining it with other things. We're not just using it on its own.
Yes. And I use the concept of glass skin, Korean glass skin, as the model for it, just having just that beautifully hydrated, so smooth, pores so small, it just reflects light. And I think a combination of a couple of those ingredients together leads to that result.
Yeah, that's my goal. That's my goal this year, to get glass skin, no matter what.
Me too. I'm having this baby, and then I'm going to be lasered and Botoxed and hydrated from within.
Yeah.
It's going to be a beautiful thing.
Good. Well, you're glowing anyway, so I'm sure the baby helps.
Thank you. So they say.
Thank you for joining us on The Beauty Scientists. Be sure to visit thebeautyscientists.com and learn more about modern beauty and connect with Dr. Hamilton and Dr. Kim.